I'm really pleased to have Dr. Jessica Armstrong here with me today. Dr. Armstrong is a friend and colleague of mine, and she's also a licensed clinical psychologist practicing in the San Francisco Bay Area. She specializes in the treatment of anxiety, depression, trauma, PTSD, and substance use disorders from a recovery-based and trauma-informed perspective. Dr. Armstrong uses a collaborative approach to find the right fit of interventions from evidence-based practices, such as acceptance and commitment therapy, cognitive behavioral therapy, cognitive processing therapy, internal family systems, and more relational and systemic approaches to meet client needs. Throughout the years, her work with a diverse array of individuals and practices has allowed insight into pain, suffering, health, and recovery through many lenses. Right. Well, Dr. Jessica, thank you so much for joining me today for this conversation. I'm really excited. We've been working together for years, collaborating on our shared patients and clients, and I've really learned so much from you throughout our collaboration, especially with regards to the trauma work that you do with your clients and our shared patients as well. So I'd love to hear more about how you became interested in bringing this trauma work into your work with your clients.
Absolutely. Thank you so much, Dr. Nishi, for having me. So glad to be here. Really excited to have this conversation with you. So my work in the trauma-focused treatment field actually began in the substance use treatment field. I was working in rehab settings and pretty quickly became attuned to the trauma-related conditions and symptoms that seemed very closely associated with the substance use symptoms. Often wasn't sufficiently acknowledged or addressed or treated. And so that led me to be focused and curious about trauma-related conditions. How does trauma leave its mark in the body, in people's lives, and their relationships, and in the actions that they might take to try to numb or escape or avoid or just survive, including substance use. So that's kind of a quick overview into how I got into trauma-related treatments.
Yeah, and it's interesting to now to see how much recognition there is of trauma and complex trauma in the mental health field, because even 30 or 40 years ago, the idea of trauma was focused on this sort of classic idea of PTSD, where people may have developed symptoms after exposure to war or something like this. But now we're understanding that trauma is much more complex than that, and it can show up in the body in many different ways. And I'd love to hear more about some of the symptoms that your clients and patients may be dealing with, whether they're dealing with sort of the classic form of PTSD that many people know about, or more subtle, complex forms of trauma.
Mm-hmm. I think it's really important to do thorough assessment on the front end with people to get a sense of not only the symptoms they're experiencing, do they map onto trauma, but what is the function of these different symptoms? So to be clearer, when it comes to PTSD, of course, there needs to be an event, but that's not the full story. We look at how did that event become associated with different experiences in the body and in the mind that people are left with. So we see things like memories, nightmares being relevant to issues with sleep. PTSD is actually one of the only disorders that has two symptoms related to sleep disturbance. So that's nightmares and sleep disturbance, insomnia, difficulty with falling asleep or staying asleep. Really hard for people to settle, to relax, to wind down. Trauma-related symptoms are about protection. They're about really preventing the person from knowing how harmed they've been, that maybe there hasn't been enough space or resource to process the trauma. So it needs to get compartmentalized. It needs to get held somewhere in the psyche or often in the body until the person is safe to process this experience. In the meantime, until that safe space or relationship to process arrives, the person is left with sometimes a sense of anxiety in their body. They might feel their heart racing, any kind of a reminder of the trauma, whether it's a conscious reminder or a sensation reminder, can trigger the person to become activated, anxious, heart racing, tension, this feeling of like having to look around. Is there a threat somewhere? So this this part who takes up the role of keeping an eye out for danger. Where this comes into to sleep is that it can be very difficult for a person to relax. Their body is really working to protect them. So this connects to fight, flight, freeze, fawn kind of a mode. The person is actively trying to assess for and prevent against threat, kind of at all times. Might not be in their conscious awareness, but is often part of their experience.
So it's really helpful to hear this framework of trauma, the trauma response as being protective. Mm-hmm. And so I recall one of my patients who describes it as being in a state of yellow alert all the time. He just felt like he couldn't relax. And there were many different reasons for that. There was history of trauma, traumatic experiences that he experienced growing up, but also there are other sociocultural aspects. This is when I was living in Chicago, and so there were various other factors that were happening in the present that were also contributing to this state of being in this yellow alert. So there are many different frameworks to actually help people manage this protective response so they can feel more agency over their nervous system, and kind of calm things down so they can sleep better and they can function better and not feel tense and not feel like they're always looking over their shoulder. And I know you've trained in various different modalities, and I'd love to hear more about the different approaches that you bring into treatment.
Absolutely. The yellow alert that you bring up also feels pretty relevant in the context of here we are, 2 years into pandemic. And so for many of us, actually, that sense of alert resonates, that hard to feel safe when our environment is giving us cues that we're not safe. And we do have parts of us that develop related to the events that we've experienced that look for that kind of threat. So we have different kinds of ways of approaching different classes of symptoms that people have. So we have alterations to mood where people don't have as much access to pleasant emotions, to interests. They lose a sense of connection to others. So there are approaches to help people kind of reconnect with others and themselves. You can use things like CBT, cognitive behavioral therapy, or CPT, cognitive processing therapy, which is a more trauma-focused version of CBT, that can help to unpack some of the beliefs that we take away from the events, these beliefs about ourselves, others, the world, that the world is a dangerous place. I can never be safe. I can't trust myself. Some of these beliefs we're aware of, and some of them we're not. And they really can connect to how we engage with others, how we engage with the world. So these kinds of methods can help us unpack what leftovers there are in the mind, how that relates to our emotions, our relationships. Acceptance and commitment therapy, or ACT, can be really useful in terms of clarifying a person's values, what's important to them, coming back to a sense of meaning and purpose. Sometimes a lived experience of PTSD can be not feeling connection to meaning or purpose. So being able to spend time really focusing on what do you care about? What do you want your life to stand for? If you could choose it, what would you choose? Can be another complement to trauma therapy. The ways that we tend to fragment. I mentioned earlier how trauma can be compartmentalized, held in the body or in our memories, in our nightmares. this is where internal family systems can be a really beautiful approach, where it can help us to start to recognize these different parts of ourselves. And you mentioned the protector aspect of trauma. If I'm viewing my threat seeking parts as a problem, as something wrong with me, or as a block to me getting to live, that keeps me kind of focused on these problems and battling them. I have to get rid of them so that way I can live, or I just want to avoid them. I don't want to deal with them. We just try to live anyway and survive with this. So, internal family systems is a way for us to actually look at all of these different parts, and most importantly, to look at them with compassion and gratitude. If it's a protector, I can wonder about it, can be curious about it. Oh, thanks for showing up. What do you want me to know? That that compassionate approach can help create an environment where all parts of the self are welcome and able to heal. The last kind of approaches I'd like to bring up are more somatically focused to really address that activation in the nervous system, that yellow alert. So things like breathing exercises. There are different approaches to breathing, holotropic breathing. Working with our breath is working with a language that our nervous system can understand. So sometimes just thinking like, hey, we're safe, calm down. Our nervous system doesn't speak in this language. It does speak in actually slowing down, breathing out more slowly than we breathe in. I just kind of opened my posture. When we are in a fight, flight, freeze response, we're not usually open or breathing slowly. So these are two powerful messages that we can send to the body and to the nervous system. Hey, we're safe. It's okay. So that way that frontal lobe can come back and think about what's happening and what we want to do. So biofeedback, EMDR, other kinds of somatic strategies can help to tap into what's stored more deeply in the body.
Wonderful. That's so helpful. And I mean, you just said so much in there, and there's a lot we could kind of unpack and explore more deeply. But I really love how you talked about bringing curiosity into your approach, as part of a practice of self-compassion. And I think that is so important because curiosity is really the antidote to judgment and self-judgment. And just bringing that curiosity to yourself of asking, okay, well, what is this telling me? What am I feeling? What could this mean? Versus having self-judgment about the symptoms that you're experiencing. That in itself can be super powerful, just simply starting to ask yourself questions versus making statements about what this means about yourself. And then the breath, as you said, the breath is so, so powerful. And, simply just breathing through your nose can be very calming. Because when we're in a state of stress and our nervous system's activated, we tend to breathe through our mouth. You can think about like when you're exercising, like when your sympathetic nervous system is activated, we breathe through our mouth. And so that tells your brain and your body that you're in a state of stress. So slowing down your breathing and nose breathing is incredibly powerful. So thank you for sharing all of that. So I'd like to talk a little bit more about sleep. And you mentioned nightmares and insomnia. About 9 out of 10 people with PTSD experience sleep issues, usually in the form of insomnia. But there can be other sleep issues as well, like obstructive sleep apnea is even more common in people with PTSD. And of course, nightmares are a hallmark symptom in PTSD. So, there's a lot of actually various issues to explore with regard to sleep, whether you're a practitioner or a clinician seeing patients. So these are some things to think about. Do they have obstructive sleep apnea or some other issue that could be contributing? Or if you oneself is experiencing PTSD, you may notice that is showing up in your sleep in various ways, or even your daytime functioning as a result of sleep issues. So,
Yes.
yeah, so could you share more about how you might assess somebody who has trauma and sleep issues? What are some questions you might ask them? What are some things you might look for? And what are some practices that you might recommend to them?
A lot of times I'm listening for signs of routines. Does the person have routines in the morning or in the evening to help their body transition between states of arousal? I'm listening for asking questions about how many hours of sleep do they get per night or per week. I'm also listening for shifts. Are there some nights where they're getting sleep, some nights where they're not? Is there a consistent pattern of struggling to fall asleep? Are there nightmares? I've noticed that with some of my patients, they'll have strategies to try to prevent nightmares, such as staying awake really late or keeping lights and TV on as they sleep to kind of interfere with nightmares. We're also talking about this nervous system arousal, that this alert mode that people's bodies are in is preparing them for action. That's the exact opposite of what we're doing when we're going to sleep. We're really trying to prepare for relax, for less action. That's really hard for a body that's kind of chronically protecting itself to do. So I'm listening for that kind of description of activation, problem sleeping, trying to prevent nightmares. I'm also asking people about what they're eating, when they're eating, how consistently they're eating, knowing that there's a relationship between nutrition and circadian rhythm. Also knowing that there's a relationship between sleep and appetite. Our appetite can be quite disrupted when our sleep is not consistent. So I'll ask about appetite, consistency of eating. Also with mood, sometimes sleep can impact mood or vice versa. So I'm listening for the presence of these different symptoms. I'm also trying to help patients connect the symptoms with each other. Often people understand, oh yeah, if I have a bad night of sleep, the next day I'm off. I'm easier to cry, or I'm ravenous. So by helping patients see the connection between their symptoms and intervening in one area that can have some benefit in others, that's one entry point into addressing sleep. I ask about routines, morning routines and night routines. Of course, night routines, it makes sense to have a winding down period. But I also think that morning routines, how we set ourselves up for the day, how we might intentionally start the day with a calming kind of a nervous system exercise, breathing, meditation, yoga, things that can set the tone for a relaxed system moving throughout the day, mindfulness, breathing throughout the day. In terms of night, there's some of the more obvious screens, not watching things, not having bright screens right before bed. That being said, you and I have talked about how sometimes the use of screens can be a support for our patients. That for some of them, maybe they have a meditation app on their phone, so they're bringing it to bed. Or maybe they're watching a show that they've seen before that is calming or lightening, that doesn't require a lot of attention, but can still have a soothing or distracting from the memories or the worries about not sleeping. These are just some initial thoughts.
Absolutely. And, as you said, these routines are so important to regulate the circadian rhythm and kind of provide anchors for the body clock. And that, of course, helps to regulate the sleep cycle, but also helps to regulate the nervous system because our nervous system naturally goes through fluctuations throughout the day. And so the more routines we can implement, the more it'll help kind of keep things on track, and it'll make it easier to self-regulate as well. Yeah. And you're really a wealth of knowledge when it comes to practical tools to regulate the nervous system. Would you mind sharing some of the tools that you use in clinical practice? And if you also have any tips for practitioners for tools that they can use with their own clients and patients?
Mm-hmm, mm-hmm. You mentioned before that curiosity as an antidote to judgment, but it also is an antidote to survival, right? When we're in survival mode, we're not really curious. We're not really looking at these things. So a strategy to use as a client and as a clinician is to help with increasing that curiosity and mindful attention to what's happening with me at night. Do I have kind of a pattern that my nervous system responds to? Is what actually relaxes my body and what is actually stimulating my body. When we're in this survival mode place, we're not really curious about what's happening. So by slowing down and wondering, what does this sensation in my body mean and what helps it? Tracking, monitoring can be a useful tool for the clinician or for the patient. There are some apps where you can track things and use. Okay, I want to go back a little bit to resources. Okay. So there are apps that you can use, things like Calm app or other mindfulness meditation apps. Some people really find to be soothing for the body, the mind, for the nervous system before bed. Yoga Nidra is a strategy that is almost like a meditation, mindfulness sleep yoga that some people will put on and find that it eases them into sleep. There can be things like aromatherapy, soft lighting. If a person does use screens, they can turn down the brightness on the screen or use apps like f.lux that can have night mode. Some computers and phones already have night mode that you can set. Different breathing and grounding strategies, having a routine with them at the end of the day can be really powerful to help the body transition from busy activity to rest and digest. Warm tea, nighttime tea. There are different supplements and roots that can be an aid. Not having a strenuous workout or a big meal right before bedtime can be helpful. We want to be thinking about what promotes sleep, but most importantly, what people will do to promote sleep. Sometimes we give them this whole list of things, or the no screens, for example, but that might not fit a person's experience or interest. So if we can find it a pleasant routine, something enjoyable, that can help with motivation to incorporate and persist with the use of these routines.
It's really important, as you said, to kind of work with where somebody is at and implementing strategies that are feasible for them and kind of fit with their interests and values and lifestyle. And what you were saying is super important, because we're looking at practices to help promote sleep, not to force the onset of sleep. All of these things are really helping to regulate the nervous system and calm things down and switch from sympathetic mode to parasympathetic mode, which is necessary for sleep onset. So choosing one or two things to start with is really helpful, and then you can start layering in other strategies. Um, you know, I'm curious to hear your thoughts on managing nightmares. Of course, this is a hallmark symptom of PTSD. And as you mentioned earlier in our discussion, people may avoid sleep because they're afraid of having a nightmare. And then that can feed into more sleep issues and daytime issues and worsening PTSD symptoms and so forth. What are some strategies you might suggest for dealing with nightmares?
That's a great question because it plagues so many of our patients. Um, I do talk about how relaxing before sleep can help. Sometimes even talking with people about their nightmares or about kind of the emotion that they're left with, being able to process that can help. I have talked with people about new outcomes for their dreams, how they wish the dream would go, what would change it from a nightmare to just a dream. And sometimes holding that in mind before going to sleep. Some people have said that can be helpful, give a sense of ease. The nightmares suggest the psyche working through things that are just too big to hold and to process in our waking life. So sometimes by the work that we're doing in our waking life to address what needs to be healed, by not avoiding our thoughts, our feelings, that can reduce nightmares as well. If we help the processing of the psyche during the day, we actually can see a shift of the processing at night. That being said, this is where I've found working with you and consulting with you to be really helpful to the strategies that you share on your YouTube videos, the sleep handout that I've been able to guide patients to. It can be really accessible, helping them think about their sleep, think about what can, as you said, promote sleep. And also when they're waking up in the middle of the night, say from the nightmares, strategies to be able to calm the nervous system, to shift into something pleasant. So I work with people to have like their go-to happy places or their go-to happy memories. I have a patient who has like a warm and fuzzies box and actually has like warm and fuzzy things. For her, the sensations actually can help her body to feel at ease and then promote returning to sleep.
I love that idea of having a box or some objects nearby that you find safe and soothing. That's such a fantastic idea. I might start recommending that one as well. Well, thank you, Dr. Jessica. This was so informative and so interesting. And I think we could keep going on, talking about trauma and internal family systems and various modalities to help people heal from trauma. So if people are interested in working with you or learning more about you, where can they find you?
So I do have private practice right now, website coming soon, but you can reach me by email at it's my initials, JL, and my last name, Armstrong, PhD@gmail.com. So you can just reach me directly there. I'm also part of a team, part of a group practice in San Francisco. It's called San Francisco Preventative Medicine Group. So you could find me through my group practice at their website, which is www.sfpmg.com. The last thing I wanted to say is just that there are a wealth of resources available online, more geared toward clinicians with evidence-based research. You have things like the National Institute of Mental Health, you have American Psychiatric Association, Mayo Clinic, but the VA actually does quite a lot of work for PTSD, for evidence-based treatments, clinical trials. They also have, the VA actually has a Center for Complementary and Alternative Medicine, which is interesting, that brings in other approaches, things like acupuncture, relaxation, mind-body approaches, self-compassion. There's a National Center for Complementary and Integrative Health. There are resources for for patients and for loved ones, because of course, PTSD doesn't only affect the person experiencing it, it affects the relationships that they're in. So things like the PTSD Foundation of America, PTSD United, National Suicide Prevention Lifeline, and even Psychology Today actually have a number of resources that are geared toward clients, their loved ones, and you can find providers that way. There's also the American Academy of Experts in Traumatic Stress. You can find providers who treat trauma-focused conditions. Lot of resources out there when you start to dig around.
That's incredibly helpful. And so what we'll do is we'll make a list of all those resources you just cited, and we'll put it in the video description. So if anyone's interested in learning more about those, you can check the video description to find the links to all of those resources. Well, thank you, Dr. Jessica, for joining me today. It was a pleasure.
Thank you so much, Dr. Nishi. So glad to be here with you.